everybody. My name is Kier Spates, and a lot of you know me as Junior from the Steve Harvey Morning Show. Welcome to the Living Your Life podcast, where we explore the inspiring stories of people who have pursued their passions and people who have successful careers while dealing with life-threatening diseases. Today, my next guest is an HBCU graduate of Spelman College. She lives in Washington, D.C., and works as a defense contractor. She's founded an organization called Sickle Cycle, which advocates both domestically and internationally for better health care. Mrs. Curtis created Sickle Cycle in May of 2017 to foster awareness about sickle cell disease and to combat issues and inequalities impacting the sickle cell community. Since its inception, Sickle Cycle has raised thousands of dollars and develop strategic partnerships to support sickle cell research and programs. I want you all to please welcome to Living Your Life podcast, Mrs. Charlotte Curtis. How you doing?
Good. Thank you for having me.
What's up, Spelman sister?
Yeah.
What's up, Spelman
Hello,
sister?
brother. How are you?
I gotta do it. I gotta do
HBCUs in
it.
this
Oh boy, it's thick. It's thick.
I ain't gonna leave Prairie View out like I ain't go there.
TV,
You
give it
It's
up.
the
Give it
HBCU
up.
love.
Yeah, it's all these HBCUs.
Yes,
Yeah,
that's right. That's right.
Everything going good. How you feeling?
I'm feeling really good.
You know what? Where were you born at, Mrs. Curtis?
I was born in Richmond, Virginia, and then I moved to Philadelphia when I was 8 years old.
8 years old. You moved to Philly.
Yes.
Philly's quite a town.
I
It's
like
quite a
Philly, man.
town. Yeah, I do a little damage there.
You do a little damage down
Yeah.
in Philly.
I have. I'm just saying.
Okay. So when were you diagnosed with sickle cell?
I was diagnosed at birth. So my parents both had the trait, and they didn't realize they had the trait until my sister was born. And my sister is 7 years older than me. And when she was born, she had jaundice. And so the doctor ended up testing her for sickle cell disease. And then they found out that she had sickle cell trait. I have a brother who is 3 years older than me, normal hemoglobin. And then when I was born, I had sickle cell disease. And this is the first time they actually kind of really had to wrestle with what does that actually mean? Because when my sister was born with the trait, they mentioned this is nothing to worry about. She doesn't have the disease. And so with me being born with the disease, it took them a while to kind of figure out what's the best resources for me. What do they do next with this newfound information? And from there, they just really tried to advocate for me and also propel me to advocate for myself.
You mentioned two things that were very, very poignant that we always want to get out on this podcast. The first thing is your parents didn't necessarily know about their sickle cell trait status. All right. That's the first thing that we have to get rid of. That we have to change that in our community. The second thing is that when your sister had trait, they were like, the doctors were like, there's nothing to worry about. And that's also something that's not true anymore. So that's why we got to get this stuff out. That's why what you're doing is so important.
Mrs. Curtis, when you were growing up, what was your crisis like when you were growing up?
I had very few crises growing up. What I ended up having was complications with my spleen, my appendix. So I ended up having to get those removed. And then as I grew up older, one of the things with sickle cell, particularly SC disease, is issues with your eye. And so it's recommended around middle age that students people with sickle cell disease, particularly SC, they have to go see an ophthalmologist each year to do eye checks. And so with that, recently, like in my 30s, I end up having complications with my eye because of that. And not understanding what that would look like. And also how easily it is, if it goes untreated, it can lead to blindness.
What?
Absolutely.
Why is that, Doc?
Well,
what happens in the eye, right?
Yeah,
Yeah.
sickling in the eye. But what is the difference, for us as SC? Because I'm SC as well.
Yeah. So basically, what happens is when you have a commingling of sickled cells, right, along with cells that are pretty healthy, which is SC persons. See, SS people tend to have a lot of sickle cells. The SC people tend not to. So what happens is that in the eye has a lot of really small microvasculature that can get basically clogged. So you don't get a lot of blood flow. And when you don't get a lot of blood flow to the organ, whatever organ it is, then it's going to cause some problems. So it's a little different for SC. And she's absolutely right.
See, I've had my eyes lasered because of sickle cell.
Sure.
Yeah, and so when she says that's important about, having to see an optometrist, which I know is very true. And that's something that a lot of us don't even take into consideration. It's something we don't even think to even bring up.
Right. And especially since, 70% of folks that are adult sickle cell patients are lost to follow-up. They haven't even talked to a doctor really since they were 18 years old. So they get to be 30, 35, 40, don't even think about the issue with the eyes, and then they end up blind. See, that's why what we're doing is so important, man. This stuff has to get out.
And there's another thing too. What happens with the spleen?
Right, okay.
Like I still have my spleen.
Really?
Yes.
Well, I've known you for a while, and I'm glad I know that, sir.
I have my spleen.
He's with spleen.
Yeah. So I just want to know, because that's important. Because how would the family respond when you had sickle cell, Mrs. Curtis? When that family found out that they have this child with this disease, how did they respond when you found out? What was that like for you?
Well, my family was just very proactive. They didn't know anybody else that had sickle cell disease, and so they relied heavily on the hospitals, the doctors, the physicians to really figure out what's the best option, what's the best care. And in Richmond, Virginia, in particularly, they have a nurse that was there that was really, really helpful to my parents in providing different informations. And as a result, she ended up being a pivotal person that was involved in the sickle cell disease chapter of America within Richmond, Virginia. And she told them about different research opportunities. She told them about different healthcare options. What were things that I needed to do? What doctors I should see? And that's one of the issues within sickle cell community. You can't just have the luxury of going to any hospital and hope that the physician or nurse will know about sickle cell disease. And so that's why the education for the patient is extremely important, because you need to be able to advocate for yourself and also be able to choose the right physicians that will be able to do right by you when you're not able to advocate, when you're in the best situation, when you're sick.
Absolutely, because that is so important. Because I can tell you, you can get a whole team of people while you're in the hospital who really don't care about your sickle cell situation, and they under medicate you.
Sure.
They just sit up there and they just say, well, if you just wait about another hour, I can give you like 0.5 more.
Yeah, exactly.
And that's an issue.
And most of these, my colleagues literally don't even have the information because they don't really treat sickle cell patients. So, if a patient comes onto the floor and they've never really dealt with them, really, they don't even know. And a lot of things have changed since you graduated from medical school or finished residency. You have to stay up on this stuff. And sickle cell to them is such a rare occurrence, which is not, but they say it is to them. It's not worth it to them. And when I say, you mean the person ain't worth it? Right. And when I say that, then it makes them kind of understand that that's their job to know and make it worth it,
Right.
But you brought up an interesting point. And I think finding the right hospitals is really crucial to life or death for those that would have sickle cell disease. And just an example of that, when I moved to Philadelphia, my parents asked around for different physicians. And fortunately, I had the opportunity of being at Children's Hospital Philadelphia, which is one of the best hospitals in my opinion.
Get the shout out. She threw the shout out for Chop. She's doing a shout out for Chop.
I say that
Philadelphia Children's is the best hospital. So you say.
Yeah, right. And so we call it Chop.
Studies have shown in terms of.
So you act like wait a minute. You act like Texas Children's.
Here we go.
Don't have. No, for real. What? Texas. You see the star?
Don't look at that star. That star's gonna blind you. Don't look at that.
Yes, but you have to go by your experience. And my experience with Children's Hospital Philadelphia has been phenomenal. In terms of education, in terms of the physicians made sure that you knew how to advocate for yourself. And I think that's very rare. And even when I was able to, transition from adult care, it was more so about, these are the questions that you need to ask. This is how you explain that you have sickle cell disease. When you are stuck in a situation where you have to see a doctor that you do not know, this is what you need to ask them. And so finding a physician, finding a hospital that has a team of people that are actually involved in your care is critically important to the development of that child, but also for the family and also for the parents.
And they're very difficult to find in other parts of the United States sometimes. I mean, Philadelphia.
Yeah, and some hospitals don't do the research. Some hospitals don't have the resources to do the research, to provide the training. You brought up, having other physicians that aren't well versed in sickle cell disease. That's another reason why telemedicine is so important.
Sure.
Using the technology that we have available for other physicians to learn from other physicians in rural communities to teach them about sickle cell disease. So therefore, when they encounter one or two patients, they know what to look for. They know how to treat them. They can use real life examples from other physicians that are renowned in this field to speak to that. And you don't have to be a hematologist, oncologist. You could be a family practitioner that is well versed.
Right.
At Spelman College. That's who I saw. I saw a family practitioner. He was not in terms of technical training versed in sickle cell disease, but he had family members that had sickle cell disease,
and he cared.
Excellent care.
And he cared, and that's the thing. Everything about sickle cell is written down. You just have to care enough to read it. And so, when you have states and cities that have a lot of Black folks, that's easier to find. But let's just say you're in Phoenix, Arizona. They got a decent amount of Black folks in Phoenix, Arizona, but they don't have a lot of sickle cell patients in Phoenix, Arizona. So if you live there, you're going to have a little bit of a problem. No knock on Phoenix. So what I'm saying is we got to get this information out because we know about this. We do this podcast. This is all over the world. This podcast is all over the world. Sickle cell is all over the world. So we got to get this information out so people can educate themselves, educate their family members. Like that family practice doctor didn't know a lot about, necessarily hematology, but his family members had this, and that's what made him care.
See, Ms. Curtis, this is why you on the show, because it's pretty impressive, your education. And you did all of this while having sickle cell. Let's just run down this list that's on my paper. I don't know what's on you, but this is on mine.
That's on mine?
Let me get this right. While having sickle cell disease, you've managed to have a Bachelor of Arts in International Studies from Spelman College. Is that true? That's correct?
Correct.
Okay. Now, you also have a master's degree in public administration. Is this correct?
Correct.
Okay. I just want to make sure. I want to hear from you. You got that from Northeastern University.
Yes.
See, this is while going through crisis.
Sure.
This is while dealing with the pain. This is what she's doing.
Yeah.
This is why she's living your life. And you also have a certificate of strategic management from Georgetown University.
This is correct.
Yeah.
See, this now
she's living her life. That's the point.
Living your life. This is what does she look like she's saying to you?
She looks mighty happy.
Yeah. Okay. and let me get this right. Also, while having sickle cell disease, you work with one of the greatest presidents of the United States, President Barack Obama administration. Is this correct?
This is correct.
What did you do with them?
That man has some soft hands, don't he? You shake his hand. That man has the soft. I shook his hand. I thought it was like a child's butt.
No, man.
I mean, I'm a pediatrician, so I deal with that. Yeah. But I'm just saying, I was like, what's up? Did you also find that his hands were very soft?
Yes, my dad had the opportunity to meet him as well.
So this is the thing about President Obama, his soft hands.
Bruh, that means he ain't done no work.
He
ain't do no work.
Yeah, not only is he
ain't changed no tires.
He got soft hands. He just put everybody at ease every time he shakes his hand. Everybody at ease.
That dude ain't never built nothing. Yeah, except the country.
I got it. So
he helped save America.
That's what I said. That's what I said. Except the country. I said the country. I said the country.
We all know that. Okay, that's interesting. Yeah. What did you do with the Obama administration?
So I worked for the Department of Homeland Security in our Office of Citizenship and Immigration Services at Busman, and so I led our public engagement outreach entities for people that were seeking citizenship. And then the last year, the administration, I worked for Corporation for National Community Service, primarily focusing on supporting White House initiatives that had to deal with community engagement. So thinking about My Brother's Keeper, Champions of Change, those kind of initiatives that really had to deal with grassroots engagement and looking at federal support.
I'm going to throw something out there because we know, obviously, Obama was the greatest president of our time. I'll throw something out there. We need to get national legislation for a sickle cell registry. So, you got his phone number? Because I want to talk.
His phone number.
I think you can help us, though. I think you can do it.
He has actually put forth a bill that's actually in draft format looking at the surveillance. And I think that's really important because when we think about the need for sickle cell patients, one of the things that you need to focus on is how many people are affected with that.
That's right.
That's how you understand what resources are able to be dedicated to that. So for instance, we use that number, over 100,000 people have sickle cell disease, but we can't break it down by state. We can't break it down by
Oh,
city
wow.
specifically from this year. We
Oh,
know
wow.
with newborn screening, we're able to understand that every newborn should be tested for sickle cell disease. But having that accurate amount of by state, how many people have sickle cell disease and what's that actual number? We use that number over $100,000. I mean, over 100,000 people, but we have been using that number for like forever. So
Can you imagine if this was a disease that affected another group of people and you don't even have the data to know how many people in your state have it? That would never happen. That would
No.
never happen. And that's why we got this vice president right now. We're about to pull some coattails because we have to get this legislation and we got to get this information so we can make the moves.
I never knew that.
Yeah.
I seriously did not know that we keep using this number over 100,000, and we could really be over 300,000.
70% lost to follow-up. 70%.
70%, and we really don't know the actual number of in this country.
Yeah.
Who have
and the challenges too, even in particular states, and I'll just use California as an example. You're supposed to notify folks that they have sickle cell disease. So yes, the newborn screening takes place, but the follow-up to inform them that they have sickle cell disease, that they have the trait, there are so many issues with providing that information. So there's so many people that are walking around, don't even know they have the trait. And that's creating a problem because if you have this population of traits that do not know they have the trait, when it's time for them to have a child with somebody else, they don't know their chances of having somebody with sickle cell disease. And therefore it creates the cycle again of having people with sickle cell disease and not understanding the education that needs to take place or even the resources that exist.
How about this? I was presenting this concept at South by Southwest. That, just for y'all that don't know, that's a festival that they have people that wear these hoodies that are about 18 years old and worth about $27 billion a piece. All right, so they come together. You know, it's in Texas.
Yes.
Oh God,
we have that.
See,
we do have that.
I'm sorry. Anyway,
we do have that.
what I presented to them, and they asked me the question, and you'll appreciate this as a social scientist as well. They asked me the question. So you're telling me that we're letting people die and letting children get this disease and letting people have this bone pain and autosplenectomy and all this kind of stuff because the lack of the aggregation of the data that already exists. That's what they asked me. I said, the answer is yes. And they were like, they couldn't believe it. They were like, they didn't even believe me. That's how bad this is. That's how bad it is.
You know, and if we having this issue and we know that this is the problem, is it the red tape that's holding us up? Is this what this is? Is just the bureaucracy? Is this what our major issue is, that we're not even trying to apply ourselves to this solution?
I'm not sure if the color of the tape is red or maybe it's another color.
Right.
That's holding us up. I'm not quite sure. What is your take on that, young lady? What do you think it is?
So I think sometimes what happens is we rely on other people to do what we need to do ourselves. And when I say that is, you know, and this is an example, when Obama came in office, everyone expected him to change everything. And it's like, do you know who your council member is? Have you attended a community meeting? Have you been active in your community? How do you want somebody to make change in an area that you live in, but you're now proactive making that same change? And so the ownership is on the person to do the research, have the education, and also to be mindful. And this is not to say that you have to be the spokesperson for whatever issue that you want to do. It's just get involved, take that first step, participate in a walk, go to a fundraiser, go to a meeting about sickle cell disease, understand how you can actually be a resource. How can you use your talents and your gifts to really help move initiatives forward? The one thing, really powerful thing that happened recently was the Sickle Cell Disease Association of America, Maryland chapter. They advocated heavily for a hospital. It was a new hospital that's going to be built in the Prince George County area. And they were like, we need to have sickle cell clinic that has blood transfusions. And what you notice about blood transfusions, particularly at an infusion center, is that it decreases the amount of people that have to endure costs from the emergency room. And so if you go to the infusion center, you're able to get your IV, your blood transfusions, anything in a certain amount of time. And it decreases the cost that's endured from actually you having to be checked into emergency room. And so what they did was advocated heavily.
You mentioned advocacy. You mentioned advocacy. Yeah, you
Yes.
mentioned advocacy. So Kier, and Kier didn't even know this yet, but my state, Louisiana, what we did the advocacy to try to get this program for registry, and we got the legislation passed. So Louisiana now has the funding and a registry for sickle cell patients. So we have the framework, so we could take that to Pennsylvania. We could take that to Georgia. We could take that because we did the exact same legislative steps, and you could do it in any other state. But you got to have the advocacy. You got to have people that want to do it.
You do have to have that.
And they were able to get it. They were able to get it done. And their new hospital in Prince George's County, guess what? They have a sickle cell clinic, and they also have an infusion center. And they're using it as a model, working with other hospitals in the area that have a sickle cell clinic to be almost to have a guidepost. So they're working with Johns Hopkins to figure out, okay, in terms of these new steps, what do we need to do? And so similar to what you just mentioned in terms of Louisiana, there's no reason why other states can't do that, but it's part of working together and being able to understand what's taking place in the community. So therefore you can do that and replicate that in other communities as well.
Now, let me ask you this though, Mrs. Curtis. So you have a child.
Yes.
Yes. You have a daughter?
Yes, I have a daughter.
Okay. Does she have sickle cell disease?
She has the trait. And so before me and my husband got married, thanks to Howard University, he was able to get tested at Howard University for free to see if he had sickle cell trait. And that's one of the good benefits of living in the district, but also living in an area that is robust and that has opportunities and resources at your disposal. And so we were able to get tested. So we knew that she was going to have the trait when she was born. And so having that education up front prepared us for, how we should educate her as she grows up. And so that was extremely helpful.
So when you all were, when you all were dating, did you discuss with him your sickle cell disease? Did you let him know when you're up front?
I didn't let him know right up front.
Like you didn't let him know first week. Yeah, you didn't tell him
nothing
no first date.
Let's sit down.
You sitting over there here with a whole disease and you didn't bring it up.
No, not like that. We were spending a lot of time together.
Yeah.
And we were spending a lot of time with someone, you're going to be committed to that person. Then I shared it with him. And I was like, does anybody in your family have sickle cell disease?
You wait till you got engaged and told him.
No, before we got engaged. Before we got engaged.
He put the ring on her finger. Let me tell you something.
You started doing this.
You need to know.
You had a ring on it.
But but after you had your first child, is your first child?
Yes, our first child. She turned 2 a couple of weeks ago.
Oh, okay. Well, happy birthday.
Get ready. Get ready.
I mean, so after you had the child,
get ready.
When y'all had a child, and you understood right off the bat that she was going to have the trait, and you just said that education had to start between you two first. And said, listen, this is what we're going to do. What is the plan for you guys when you're raising a child with the trait?
So there's a book by Princess Wells, and it's called Sickle Cells. And in that book, it's a character that talks about how she has sickle cell disease and what she needs to do for sickle cell disease. And it's literally a book that's literally geared towards middle-aged students. But her seeing that, understanding how what the sickle cell shapes look like, helps her be informed why hydration is so important, why not overexerting yourself is important, why rest is important. And these are things that, yes, we all should be conscious of, right? Like, even if you don't have sickle cell disease, you should be drinking water. You should be eating healthy. You should be worried about fitness, all those things. But especially if you have sickle cell disease, that's one of the things you need to be worried about. And also if you have the trait. So having that education about the disease helps inform her as having a trait, because it's important about who she has a child with moving forward. And also for her own health, safety. When you go to the doctor and they ask you questions about your family history, she needs to know all this information.
Absolutely. So, you started an organization. Sickle Cycle.
Yeah.
What is Sickle Cycle, and why should we know about this?
So Sickle Cycle is a platform to share information. It's almost like a research hub. So if you want to know about different ways that you want to get involved in the sickle cell community, but you don't know what step you want to take, there's information about research, information about different events taking place across the globe, different countries. If you want to know more about cure opportunities, whether it's bone marrow or gene editing, the information is listed out there. And the reason why I created this is because as I was doing my own research and experiencing different complications as I grew older, I didn't want that information to just stay with me. I was like, wow, I didn't know that it's more common for, you can use CRISPR to find a cure for sickle cell disease. Like, all these tools are taking place, but it's also, you have to be in the forefront, and you also have to be educated to know what's going on, to understand how do you want to play in this role, or how do you want to be in the community. And so because of that, like, we work with different pharmaceutical companies, informing them about patient experiences. So it informs what they're going to do, what drug they're making, how their patient outreach is going, and informing them about the materials that they're sharing as well.
Well, you know what? That sounds like an encyclopedia for sickle cell is what this is. You can get all the information you need to know about this.
That's right. She mentioned CRISPR. Most Black folks, we think CRISPR is how we like our fried cabbage, not the technology. So I think that I'm glad you.
The gene editing tool that is actually saving lives. And
exactly right.
Understanding how that even started. It didn't start with sickle cell disease. It started with HIV initially,
That's right.
And then now it's branching out to different resources and different technology and different diseases to kind of figure out, how do you solve these issues? How do you solve? And they're actually having case studies that are showing how people are thriving after having gene editing. Other piece of that is working in your local community, understanding how to get involved. We mentioned advocacy. Different chapters across the globe have Advocacy Day, where you can talk to different city councilors, senators, in reference to the issues that are plaguing the sickle cell community in your respective area. And so having that kind of knowledge, being active, informs you, and also just the opportunity to meet other patients. That's the thing with sickle cell disease. I could have the same experience that you have, or we could have totally different complications that we're experiencing.
Yeah.
But that's because it's so unique and it's very individualized. And I think the more people that share their experience and share their opportunities, how powerful that will be for people to be informed about how to treat this very complicated disease. We also have a podcast that we share information similar to how you do.
A podcast?
Wait a minute.
Yes.
Hey. All right.
Which highlights from patients' experience, but also providers. We had somebody speak, that's from Johns Hopkins University, that talked about ophthalmology, the sickling in the eye, and understanding the history and the connection of that. What people need to do to prepare for if they are experiencing issues. Also looking at, we had Dr. Henny Frampon. He passed last year, but he is one of the greats in the sickle cell community. And his knowledge of the history of sickle cell disease is by far one of the best. Like, just having the opportunity to have him to talk about his experiences as a professional, as a doctor, as a physician, but also him being able to share that he went back to Ghana, started a couple clinics in Ghana for sickle cell disease, and that's been his life passion.
Wow. Well, Ms. Curtis, thank you so much for being on the show today. I mean, we want to thank you for all you're doing to help continue the fight to eradicate sickle cell disease worldwide. Again, everybody, her website is sicklecycle.com. Go check it out. That's sicklecycle.com. Look, we want to thank you, Mrs. Curtis, for stopping by.
Absolutely.
Living your life. You are absolutely outstanding person.
Living your life.
Piece of knowledge. And guess what? You don't even look like you're going through anything with your sister. You're just living your life.
That's because she eats right and drinks a bunch of water.
Yeah. Yes.
Okay.
I mean, I'm talking about you doing
everyone.
it. Yes. So thank you so much for being here. We really appreciate you. Ladies and gentlemen, Mrs. Charlotte Curtis. Y'all give a round of applause. This Charlotte Curtis. Yes, you did. You did
Thank you for the opportunity. And congratulations to you.